Hi, my name is Melissa Vesperman. I'm the Executive Director and the Manager of the Nurses at St. Croix Valley Sexual Assault Response Team. I'm also one of the on-call nurses. So if you do come for an exam, you might get me as one of your nurses that responds. I have been a nurse for almost 20 years, and I have been a forensic nurse for almost 13 years. The process is very much the same whether you're in a hospital emergency room or in our community-based sites. The important thing to remember about our exams is that as the patient, you are in charge of the entire process. Whatever decisions you make, the nurse will respect that those are the decisions that are best for you. We will provide you with a lot of education about those choices so you feel informed when you're making decisions, but there will be no pressure from the nurse to have you do parts of the exam that you are not comfortable with. And that includes reporting to law enforcement. With the advocate, the nurse will be able to explain all of your choices to you, including reporting, and you get to decide whether those choices are right for you or not. Once we've explained that part of the exam and that you're in charge, we will start by offering you consents. Do you consent for the nurse to speak with the advocate on your behalf? Do you consent to photographs? Do you consent to reporting to law enforcement? Those are the kind of things that we will talk about right away in the exam, but you don't have to have the answers right away. We at least get the opportunity to educate you about what those choices mean. And then we start out with very, very basic information, demographic information. Where do you live? What date did this happen to you? Your medical history. Do you take medications? Do you have any medical diagnosis? What is your sexual health history? Have you had any surgeries? So really trying to start out with some simple questions, and always knowing that you don't have to answer all of the questions. If there's questions that make you uncomfortable or things that you'd rather not disclose, again, those are your choices. Then we will ask if you are comfortable sharing what happened to you during the assault. Again, you do not have to, or sometimes you may not really know or remember, and that's okay too. It can be really helpful for our nurses to know if you're able to share so that we know where to look for evidence, where to look for injuries, and where to do our physical assessment. But again, it is not necessary to have the exam done. Then we will move into talking about sexually transmitted infections and pregnancy, your risk for those based on what we have learned, and then talking about whether testing for those is a better option or if we can treat them prophylactically or treat them before they even become a problem for you. In addition to that, we will do a head-to-toe exam if that is something that you're wanting. We will check your whole body over for injuries, for pain. Sometimes injuries aren't visible at the time of the exam, so we do a lot of touching and visualization of your body. And again, that is completely up to you as the patient. Sometimes people only want us to look at certain portions of their body. Sometimes they want us to look at all of their body, and sometimes they don't want that part of the exam at all, and that is completely okay. A good portion of that head-to-toe physical exam also includes a genital exam. So whether you were a male or female that was assaulted, we may want to look there to make sure that there is no injury, no sign of infection, or anything else that might be concerning. With that, we can also be doing evidence collection at the same time. That may sound like it's a scary process, but evidence collection is basically just a Q-tip with a very soft end that we gently roll over parts of your skin for the most part. That could involve a speculum exam if you're a female, and it could involve doing some swabs on the inside of the genitals, but again, those choices are completely up to you. In addition to evidence collection, we could also be doing photography. So if we did see any areas that were concerning on the body exam, injuries or something that looked abnormal, we can do photographic documentation of those areas as well. Lastly, a big part of the exam was also doing some education and talking to you about what comes next. So between the nurse and the advocate, we really partner to make sure that you have all the information that you need while trying not to overwhelm you at the same time, and making sure that you are being heard and your wishes are being respected the entire part of the exam.